Thomas Alpernasik, MD. I'm an adjunct professor of orthopedics at University of South Florida. I'm the program director of the Florida Orthopaedic Institute Adult Reconstruction Fellowship, and I've been here in Tampa for over 30 years. FOI started in 1989. It was a group of us that left the University of South Florida, which was my initial job when I left the Mayo Clinic.
I'm Dr. Kenneth Gusky, and I have now been here in Tampa with the University of South Florida and the Florida Orthopaedic Institute now for 40 years. Our interest was in resident education at the time with the University of South Florida, so I thought it would be an excellent location to further my educational desire by training fellows that would be more interested in the type of practice that I was having.
The Florida Orthopaedic Institute began as an aggregation of subspecialists in orthopedics, and we grew from an initial group of approximately 10 surgeons to now where we have almost 100 surgeons in our practice. The Florida Orthopaedic Institute Adult Reconstruction Fellowship is focused on the treatment of hip and knee arthritis, joint replacement, and revision joint replacement. I think in modern orthopedic training, a fellowship has become a very important adjunct, really finishing school for the resident.
Fellowship is really one last year to sort of prepare yourself before you transition into independent practice. And so things that I am looking for in a fellowship really are sort of that graduated autonomy and an exposure to a number of complex cases that I likely am to encounter when I go out on my own.
If you want to be a joint specialist, being able to do not only primary but revision joint replacement, it's mandatory that you have the extra training that's availed by a fellowship.
You feel pretty empowered when you're done with your residency after 5 years. When you then attend a fellowship, you start to realize the holes and the gaps in your training that you didn't really realize that you had.
Focusing on the hip and knee side, especially for the complex and revision cases, was something that I wanted to do, and I didn't think that it was appropriate to take on that kind of challenge without having an extra year training under people who are experts in that field.
The true strength of our fellowship program is the variety of surgeons that they're exposed to, the variety of implant systems that they're exposed to, a variety of levels of training that they're exposed to in regards to the attendings.
The fellows get to spend time with each of the core attendings. By having a lot of one-on-one time, it lends itself to discussion and mentorship.
I felt that mentorship was important, and so that's something that I wanted to seek this year. And I felt like when I interviewed here at FOI that was available to me.
And after meeting the surgeons here, I was convinced that this was the best place to train and learn how to be a good surgeon, but also how to run a successful practice.
FOI was a good place to be because you get every technique and exposure with all the major approaches to the hip and all the different philosophies of balancing knees, and good exposure to technology, including robotics and computer-assisted surgery.
All of our surgeons utilize technology, computers, navigation, robotics when we're doing our replacement surgeries. Personally, the benefit of this, I think, is that we're able to hit the target a little bit more accurately when we use the technology. How can we eliminate those outliers of the patients that aren't doing well? And how can we get a more perfect surgery? And I think our philosophy here at FOI is that we use this technology to improve those outcomes for those patients.
You need to see new technology being used. The attendings in our program, including myself, have been actively involved over the years in implant design. I personally designed 3 different total knee implants. I've designed 6 different total hip implants. I was a lead designer on the Mako total knee design, which is the foremost robotic total knee application in the world at this point.
We have physicians at numerous different hospitals, numerous different hospital systems, and we've all kind of independently built our own unique practices. And I think it allows the fellows an opportunity to see many different ways of doing things. All aspects of private practice, because a lot of what happens that makes a surgeon successful happens outside of the operating room. And I think that gives you some additional education in those things that aren't covered in textbooks as much.
You have large hospitals, small hospitals, and hospitals in between, and I think what that provides is a breadth of training that shows what it's like to practice when you don't have a lot of help, what it's like to practice when you have too much help.
The benefit of having multiple affiliations is that you really get to kind of touch and sample from a variety of atmospheres, in orthopedics. Obviously at Tampa General, it's more academic, has that sense about it, whereas in the community you get to see how private practices run.
Here at FOI, this is a private-demic sort of model, and so in addition to getting all of the benefits of being at a large academic center, we also have a great deal of exposure to a private practice working environment. And so I think that really positions us well to be very competitive in both sort of markets when we come out.
Research is a very important part of our program. Fellows are expected to do at least one publishable paper as well as additional work. We're standing now in 5 labs, which is a bioskills lab. This is a very well-resourced and extensive bioskills lab that's used by all different manufacturers throughout the year. This exposure is readily available to the fellows, so one will get numerous opportunities to do cadaveric as well as various implant systems in this lab.
So it's actually a really exciting time for research here at FOI. We are on the cusp of really getting our research program to a new level. The goal would be to allow our fellows to have more meaningful projects, have access to large amounts of data, and really to help drive the future of joint replacement.
Tampa is a very dynamic community. It is growing rapidly and it is highly resourced. It gives us the platform to have a fellowship that is really second to none.
We have the Stanley Cup champion Lightning. We have a more successful football team this year than we have had. We've got the Rays, we're in the World Series. Disney World's an hour drive. So it's a good central location in Florida to really explore all that Florida has to offer.
The interior of Florida is incredible. The natural beauty, the abilities to go hunting if you're into that, or other sports are just incredible. This is an outdoorsman state for sure.
What our fellowship really offers is kind of twofold in a sense. One, you get a lot of experience, high volume cases, complexity of cases. And when you're not operating, you live in Florida. So the benefit of that is beaches, good weather, outside activities, and I think that you can kind of marry the two of these things. Work hard, play hard. It's a great opportunity.
This program sticks out, one, because of the location. Spending an extra year and your final year of training next to the beach is very nice. And two, you get to work with some of the best surgeons in the country. When it came down to choosing between other great options, living in Tampa for your final year of training was definitely the best option. My wife really appreciated that.
The physicians here are very thorough and do an excellent job of helping us to develop a thought process when we tackle each of our individual surgical issues.
I have learned valuable insights on how to balance knees, the subtleties of indications in patients that have complicated problems, and how to develop a relationship with the patient from the first time you meet them that ensures a successful journey through surgical treatment.
We basically will give a width and breadth of training that is unparalleled anywhere.
If you spend a year here, when you're done, you'll be able to manage any level of complexity arthroplasty issue.
We're going to do a very good job of preparing the fellow to go in and be successful in private practice, to tackle the tough cases, but you're also going to be exposed to all of the various implant companies, systems, and ways of doing surgery, which is going to allow the fellow to really pick the techniques and implants that they feel work best for their practice situation.
When you finish the fellowship, you're ready to take on whatever comes through your door. And if you feel comfortable taking on primary, complex, total knees or total hips, any revision, then I think that you've achieved your goal. You're ready to start your practice.
We are a fellowship-centric practice. We want you to become superb and excellent clinicians, and at the same time to develop your academic credentials and to do research. For more information, please go to our website at www.floridaortho.com.